Let's start with some of the updated information from today's numbers. You start with the cases. Cases 737. You can compare that to the 21-day average. Of course, the 21-day average is going up because the case numbers are going up. So we are seeing a continued increase in number of cases. The deaths, recording 11. Hospitalization 65. So those are up a little bit of hospitalization today from the 21-day average. And ICU admissions are up slightly as well. So those are the key data. Let me talk a little bit more about the long-term trends in regard to hospitalizations. And hospitalization is a lagging indicator, obviously. Someone is infected, it takes a while, they get sick, go to the hospital. But last week is a significant week. From June 21 to June 27. It was the first week of increasing COVID-19 hospital utilization in the state for over 2 months. We have to go back since late April was the last time we had this much. So it's starting to go up slightly. The number of standard hospital beds occupied by COVID-19 positive patients peaked in late April and early May at about 1,000. They reached a low of 513 on June 20th. So June 20th was our low. Just last week, though, we had about 500 to 550 total COVID patients in Ohio's hospitals. Now, these numbers, of course, are not hospital admissions each day. These are just who's occupying these beds, which from a point of view of being concerned long-term about having the requisite space. So we keep track of how many go in each day, but we also keep track of what the hospital capacity is and how many are in the hospital. So again, last week we had about 500 to 550 total COVID patients in Ohio's hospitals. This week we're now at around 650. The ICU and ventilator utilization is still holding pretty steady. But we are seeing increases in those in some parts of the state. The increase in COVID hospital occupancy is most apparent in regions 2, 3, and 6, and that is Cleveland, that is Dayton, and Cincinnati, those regions. In other regions of the state, the COVID hospital occupancy had been declining, but now appears to have leveled off. In the Dayton and Cincinnati areas, the recent increase in hospital utilization does include standard beds as well as ICU beds and ventilators. Although COVID utilization in hospitals is increasing, I want to make it very clear, there's still adequate overall capacity available across Ohio. No region has reached a concern threshold of 80%, which is when the hospitals start getting concerned, of overall utilization for ICU beds. So we're not there. But we do know from lessons of recent history in New York City, Houston, Arizona, that this can fairly quickly change. I want to talk about the positivity number, which we have talked about before. And this is it is a slide that shows number of tests, as you can see, for each day, number of tests. And it also shows the positivity rate, which was at last one was at 4.7. Now I know, we have increased testing, as you can see, and we're very happy that we've done that. We're not where we want to be yet. We got a ways to go, but we've significantly increased testing, and people have done a very, very good job across the state getting those numbers up. The testing is so very important, so we can determine who has it, because many people have it and don't know they have it, do not really have the symptoms. But finding out who has it so that they can be taken care of, and also we can slow the spread of COVID-19 is so very, very important.